Good day, dear friends. I'm glad to welcome you to Dr. Savkina's channel. Pneumonia in coronavirus infection is more correctly called COVID pneumonia because the inflammation of the lungs proceeds differently. In this case, the wall, alveoli, and connective tissue are involved in the inflammatory process. Hence, the complication of thrombosis of small vessels and the formation of fibrous tissue, in other words, scarring. How dangerous is pulmonary fibrosis? Can it be detected and eliminated in time? We will talk about this with you today. The course of pneumonia against the backdrop of a new coronavirus infection is quite unpredictable. In some cases, upon admission to the hospital, insignificant damage to the lung tissue is noted. Well, let's say about 20% on the right and 15% on the left. In medical terms, this is a CT score. Further on, there is a rapid, relentless involvement of all new participants of the lungs with the development of total lung damage. And quite an unsettling finale. Moreover, it's not always about elderly people with a range of comorbidities. Sometimes patients over 75 are admitted to the ward with the lung tissue damage exceeding 50%. And they go home on their own feet. Everything here is unpredictable. What is the danger of developing fibrosis in coronavirus disease pneumonia? Fibrosis is a consequence of sustained inflammation, the case when normal lung tissue is replaced by fibrous. Essentially, a scar is formed. If the lung fibrosis is insignificant, well, let's say the volume of affected lung tissue involves one segment, then in this case it may not affect our health at all. I'm referring to the function of breathing. In the case where fibrosis affects several segments of the lungs and sometimes the whole lobe, and in some cases it's a bilateral process, then serious and sometimes irreversible consequences are noted. I mean from the point of view of the development of severe respiratory insufficiency. How to understand and feel the formation of fibrosis against the background of coronavirus disease pneumonia. With normal physical stress, shortness of breath appears, which can persist for several weeks or even months. Constant unproductive cough, expressed weakness, lethargy, and reduced work capacity are disturbing. Is it possible to confirm your fears about the development of post-COVID fibrosis? For this, you need to do a lung scan and spirometry to assess the volume of inhaled and exhaled air, as well as the vital capacity of the lungs. In the presence of significant fibrosis, these indicators decrease. Is it possible to avoid the development of fibrosis? Unfortunately, at present, there are no highly effective drugs that allow us to avoid fibrosis in coronavirus disease pneumonia. To achieve success, it is necessary to incorporate respiratory gymnastics into the treatment process as early as possible. To date, there are quite a few methods of respiratory gymnastics. First and foremost, this includes therapeutic breathing exercises according to Strelnikova, yoga breathing, and Buteyko breathing. It is very beneficial to do one simple exercise 3 times a day for 10 minutes. Blow air through a straw into a glass of water. Take a not too narrow straw, fill half a glass with water. Slowly inhale, counting to 4 in the process. Then exhale through the straw into the water, counting to 6. The exhale should be 1.5 times longer than the inhale. Many of you are familiar with such an exercise as inflating air balloons. Some make a serious mistake by starting to practice this exercise during an acute illness period, which is fundamentally wrong due to the risk of damaging the inflamed lung tissue. Why? Yes, because the lung can simply rupture with the development of a life-threatening condition, so-called pneumothorax. Many of you are interested in the question of how to approach physical stress during the recovery period. First of all, in this case, you cannot overdo it. Physical stress at the rehabilitation stage should be individual and dosed. In this regard, great benefits are brought by walking in the fresh air, Scandinavian walking, during which the muscles of the upper shoulder girdle are involved, which contributes to the drainage function and improves the blood supply to the lung tissue. Some of you actively practice inhalations with essential oils at home. You definitely should not do this. I draw your attention to the fact that if essential oil gets into the respiratory tract, it can itself provoke inflammation of the alveoli and subsequently contribute to the development of fibrosis. Many of you are interested in the question, can fibrosis be reversed? Unfortunately, if it has already formed, it is unlikely that it can be gotten rid of. However, in practice, there are cases when radiologists mistakenly diagnose lung fibrosis, taking other processes occurring in the connective tissue of the lungs for it. Further treatment of such so-called lung fibrosis becomes a great success. Who among those who have had coronavirus disease most often encounters the formation of lung fibrosis? First of all, smokers with experience, people over 65 years old, and also patients who are observed by a rheumatologist with connective tissue diseases, for example, with rheumatoid arthritis, systemic lupus erythematosus, dermatomyositis, systemic scleroderma, and a whole range of other systemic inflammatory diseases of the connective tissue. By prescription from the stationary, many doctors recommend using candles with languidus for the prevention of fibrosis formation in the lung tissue. Cases are described in the literature when the restoration of lung tissue after COVID occurred successfully after the use of candles with languidacea. Languidacea really prevents further expansion of connective tissue, reduces swelling and inflammation, enhances the activity of antibiotic therapy, and contributes to the strengthening of immune defense. For the sake of accuracy, I repeat, some specialists seeing specific changes in connective tissue on X-rays interpret them as fibrosis. In fact, it should take at least 3 months to confirm the fact of lung fibrosis formation. Currently, there are studies that prove the effectiveness of systemic enzymes, and first of all, WOB enzyme and FLOC enzyme. In the prevention and treatment of fibrotic processes, they provide complex anti-inflammatory, anti-aggregant, fibrinolytic, and anti-edema effects. And in the case of post-COVID fibrosis, nattokinase and serrapeptase act as the main preparations of systemic endemopathy. A certain role in the treatment of post-COVID fibrosis is also played by the method of physiotherapy. Laser therapy, which prevents the development of the scarring process in the lung tissue, is considered particularly effective in this case. Some doctors traditionally treat lung fibrosis. They recommend their patients non-steroidal anti-inflammatory drugs, but they do not work in this case. Moreover, they can do much more harm than good, since the liver suffers greatly from the powerful complex therapy conducted in hospitals for the treatment of the new coronavirus infection. If you're interested in which drug to prefer for the treatment of the new coronavirus infection, Coronavir or Orbidol, I recommend you watch this video. Stay healthy, dear friends, until new meetings.